More than £45,000 has been donated to gyms in Merseyside after they were fined by police for refusing to close. Liverpool is now in the Tier 3 category, also known as very high, which requires gyms, bars and betting shops to shut. Well, the owner of Bodytech Fitness, who was fined £1,000, said he was keeping his gym open for members' mental and physical well-being and not for financial gain. Let's bring in the owner now, Nick Whitcomb. Alongside Nick is Chris Ellerby-Hemmings, whose gym has also been fined. Hello to you both. Nick, tell us what happened. You decided to stay open. Why?
Well, it wasn't much of a choice. We've been forced to make this decision. First and foremost, as we said, this decision came with the mental and physical well-being of our members in mind. We know from the statistics that we're not the risk. Government's own data suggests that gyms as a whole are only responsible for 1.7% of the infection rate across the country. We've collectively had 22 million visits to gyms across the UK from the 24th of July to mid-September. 22 million, and there's only been 78 confirmed cases. You have hospitality responsible for 25% of the infection rate. We have the education sector responsible for 36% of the infection rate, yet gyms at 1.7% have been forced to close. And the potential health implications for our members, both physical health and mental health, is catastrophic. We simply can't allow this to happen. This is for the people, as you say, we've been fined, and the fines that we are going to be facing are, it's going to creep up and it's going to become exponential. This isn't about money for us. This is about our people and doing what's right. Our police stand by us, our MPs stand by us, our mayors stand by us. There is no evidence to support.
The police don't stand by you, do they? Because they issued you with a fine. And no matter what we think of the rules are the rules, and they're put in place to try and protect people's lives. And what you've done is break those rules.
So the police, when they attended our facility on both occasions, both my facility and Chris's, have said that obviously they don't endorse us breaking the law, but they agree with us entirely that this decision has been made incorrectly. The data does not support the decision. The police are with us, the politicians are with us, our mayors are with us, Manchester stands with us. We need to have this looked at. That's all we're asking. Just look at the data. If you can show us new evidence that we're unaware of, that government haven't published, that we are the risk and closing would be beneficial to stopping the spread of COVID, which is everybody's priority number one, we will close immediately, no questions asked.
Chris, why is it one rule for you and another for everyone else? Because the pubs and the bars have all had to close, haven't they? You're staying open. Why couldn't they then?
This isn't something that we've taken lightly. We've got 70 gyms that have done this across Merseyside, so it's not just me and Nick that's done this. It's actually the entirety, about 65% of the gyms in the Merseyside area that have done it. The reason we've done it is not just willy-nilly because of money. We've done it because of people's health, because of people's well-being. Now, if we close the gyms, the suicide rate has already doubled since last year. I'm right in saying that, aren't I?
Yeah.
So it's doubled since last year, which means by closing the gyms where people have an outlet, there's going to be more suicides. That could be the day after we close the gyms. So I've refused to do it. It might not be the right thing, but we feel like it's the right thing to do. And guess what?
The mental health implications of lockdown and the pandemic are huge, and I hear what you're saying there, but there are other ways that you could support your members, aren't there? You can support them online, you can support them remotely without bringing people together, because this virus thrives on social contact, human-to-human contact.
Yeah, definitely. So Thea and I own the gym here at Empowered Fit, and during lockdown we used social media, we used text messaging, and we had, it's sad to say, I don't like to say it out loud, we had a list of about 50 to 100 of our members who were on suicide watch. That meant we were texting them daily to do silly things like checking they'd had a shower, checking they'd eaten, checking they'd been to bed, got some sleep. It's a very sad situation.
So just to elaborate on Chris's points, and I think that what to take away from this is the last time that we had the national lockdown enforced, we complied to 100% complied. We didn't understand anything at the time. We had no evidence, we had no data, we had no statistics. It was safest for everybody. If we closed, we did so, no questions asked. This time we have the data at hand. It doesn't support the decision that's been made. We are the lowest of all the sectors for the infection rate. not to mention the benefits that come out of the fitness industry as a whole, combating diabetes, obesity, and again, obviously mental health once again. I mean, we talk about saving the NHS. Obesity alone costs the NHS $9 billion a year, $27 billion across wider society. The biggest treatment for that is exercise and education on nutrition. We offer both. We are part of the solution, not part of the problem. We want to help combat COVID as much as the rest.
My point is just that you don't necessarily have to do that in a gym. And Nick, what do you think when the NHS intensive care units in your area in Liverpool are reaching a critical point? What do you think they would say to you breaking the rules?
I think it's catastrophic that we're in the situation that we're in now. You know, we've never experienced hardship like this physically or mentally as a nation, never mind as a borough. We know that we're not contributing to the hospital admissions. We know that we're not part of the problem. So what we're suggesting is allow us to be part of the solution, allow us to alleviate the strain on the NHS, allow us to keep people fit, keep people healthy. The measures that we have in place that the government forced us to put in place, which we were happy to do so after the last lockdown, it is sufficient. The data proves that it's sufficient.
We're out of time. I'm really sorry. Nick Whitcomb, Chris Ellerby-Hemmings, thank you both very much indeed.